Hi Joshua, my name is Romina. I'm a nurse practitioner. I'm gonna get you started with your physical exam. Okay, but first I'm gonna ask you, did you go to the restroom? Were you able to urinate?
Yes.
Okay, good. So go ahead and stand up right there. I'm gonna check your height. You're 5 feet, 4 inches tall. Go ahead and hop into that scale and 120 pounds. Go ahead and sit down right here. Check your blood pressure. I'll check your oxygen saturation and your temperature, okay? Your blood pressure is 150/72. Temperature is 36.5. Oxygen saturation is 98. And your heart rate is 76. Okay, Joshua, I'm gonna start with your head examination. I'm just gonna check your skin on your face. So your face is smooth and soft and even color. I'm gonna check your skin elasticity. So your skin is elastic. No lesions of any kind. Just gonna look on your scalp. Your scalp is intact, no lesion on your scalp or scabs. You have few like dried acne on your forehead. I'm just gonna have to palpate your scalp, okay? So scalp is symmetric, no indentation or depression. I'm gonna check your facial nerve, Joshua, and that's cranial nerve number 7. I'm gonna ask you to clench your teeth. Good. Squeeze eyes tight shut. Okay. Wrinkle your forehead. Okay. Smile and puff out your cheek. Good. So cranial nerve number 7 shows facial symmetry. Okay. I'm gonna check on your facial bone. I'm gonna have to just palpate your face and your bones. Facial bones is intact, no depression or irregular groove. I'm just gonna check your sinus. Is there any pain in your sinus? No? Okay, I'm gonna check your temporomandibular joint. Okay, go ahead and open your mouth. Okay, close. Okay, so there's no, I didn't feel any clicking in your jaw. I'm gonna check for cranial nerve number 5, that's trigeminal nerve. I'm gonna check for facial muscle tone. Okay, so your face is symmetric in tone. No twitching. I'm gonna check your sensation, okay? We're gonna start with light sensation in your forehead, on your cheek, in your chin, and your other side of your cheek. Did you feel that? Okay. This time I'm gonna check for a different sensation. Let me know if it is sharp or dull, okay?
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, good. There is a symmetric discrimination in each location to all examining your eyes, Joshua. Okay, I will start with your eyelids. Okay, superior eyelid is covering portion of your iris when open. Eyelashes are present on both lids, turn outwards. You can check your conjunctiva and your sclera. Left sclera and conjunctiva. Sclera is white, conjunctiva is pink. Same on the right. Sclera is white, conjunctiva is pink. I'm going to do a cover and a cover test, okay? This will show if there's any extra movements in your eyes. I'm going to need you to focus on that object right there. And I'm going to cover one eye. And then do the other eye. Good. So it didn't show any extra movements in your eyes. Let me check your visual fields and extraocular movements. That will check cranial nerve number 3, 4, and 6. Okay? I'm going to shine a light in your eye. Don't move your eye. So on your left eye, pupils are 2 millimeters, equal size, equal and consensual response to light and accommodation. I'm going to check on your right. Same thing on your right. Pupils are 2 millimeter in equal size, equal and consensual response to light and accommodation. Okay, I'm gonna need you to just look straight and look at my pen. Okay, this will check for your extraocular movement, okay? Try not to move your head, okay? Just follow my pen. Okay, so it shows smooth and coordinated movements of your eyes. Joshua, I'm going to examine your ears. I'm going to start with inspection. Okay, no lesions or any mass. Kind of palpate your ears. So no tenderness. Auricle is equal size and similar in appearance. I'm going to use my otoscope and check on your ear canal, okay? There's a small amount of cerumen in that left ear. And same thing on the right, but both tympanic membrane looks translucent, pearly gray with normal light reflex. Okay. I'm going to whisper some more to you. This will check cranial nerve number 8, which is the acoustic, and you just need to repeat up after me, okay?
Apple. Orange.
Okay, good. So you passed that test for cranial nerve number 8, acoustic nerve. I will do the bone conduction and air conduction test. Do you hear it in both ears or just one ear?
Both.
Both. Okay. I'm gonna need you to cover one ear for me. Where do you hear it greatest? The covered or uncovered ear?
Covered.
That's good. Gonna need you to uncover the next one. Cover and uncover ear.
Cover.
That's good. So that is the Weber test. I'm gonna check for the Rhine test. This is number 1. And this is 2. Which one is louder? 1 or 2?
2.
That's good. Do it on the other ear. 1, 2. Which one is louder? 1 or 2? 2. That's good. That means air conduction is greater than bone conduction, which is normal. I'll be checking on your nose, okay? So I'm just checking on your nose structure. Smooth midline, conforms to the face color, oval and symmetrical in position. Okay. Position of the septum is firm and stable. Okay. I'm gonna shine a light on your nose to check on your nostrils. Okay. So no noiseless breathing. I'm gonna inspect the inside, check on your mucosa. Okay, so it's the mucosa and the septum turbinates. Mucosa is deep pink and glistening, septum close to the midline and fairly straight. Thicker anteriorly than the posteriorly, inferior and middle turbinate are visible. I'll be checking on your mouth and your pharynx, Joshua. I'll inspect your mouth. So your lips is symmetric, vertically and horizontally, pink and smooth. I'm gonna need you to open your mouth for me. Check on your teeth. Okay, so your teeth are complete, 32 of them, firmly anchored, ivory in color. Check on your mucosa. Open your mouth again, sweetie. Okay, so your mucosa is pink, red and smooth. Check on your gums. Okay. Gums is pinkish red, clearly defined, no inflammation, bleeding, or any swelling. Okay, I'm gonna check on your tongue. Okay, open your mouth. Okay. Tongue is in midline, no fasciculation, dull red in color, moist, glistening, smooth yet roughened surface, ventral surface, pink and smooth too. Okay, I'm gonna check your hard palate. Can you tilt your head for me? Okay. Hard palate is whitish and dome shaped with transverse rugae. I'm gonna check on your soft palate. Put your head down a little bit. So your soft palate rises symmetrically with the uvula on the midline. I'm just gonna have to stick your tongue out for me. Ah, say ah.
Ah.
Good. So the tonsils is pink and not swollen. Okay. One more time. I'm just gonna have stick your tongue out. Okay. So then just check your gag reflex, and that also. So it's intact bilateral response, and that checks for your hypoglossal, which is the cranial nerve number 12, and cranial nerve number 10, which is the vagus nerve. Another test for the hypoglossal is I'm going to inspect your tongue and mouth while protruding for symmetry and tremors. So I'm going to check cranial nerve number 12, which is the hypoglossal. Okay, Josh? I'm going to need you to open your mouth, stick your tongue out, in and out, in and out. Okay. Touch the side of your lips from side to side. Okay, good. And curl up and down. Okay. I'm gonna need you to put pressure on your cheek. On your other side. Good. So that checks your hypoglossal. So results is no asymmetry, no deviation, no fasciculation, or no atrophy. Joshua, I'll be checking on your neck right now. Okay. I'll be checking. Do some inspection on your neck. Check on any jugular vein distension. So there's no distension on your jugular vein. I'm gonna need you to perform some range of motion movement. I'm gonna need you to put your head down, up, on your left side, up, back, up, and your right. Oh, okay. I'm gonna just put some resistance in my hand. Okay, and your other side too. Okay, I'm gonna need you to shrug your shoulders. Put it down. Okay. So that checks also the cranial nerve number 9, which is the spinal accessory muscle. Okay. So the trapezius and sternocleidomastoid muscle is bilaterally symmetric. Then I'm gonna have to palpate with your carotid pulse. This one. So each pulse is strong and regular. Okay. I'm just gonna check on your tracheal position. Can you swallow? Okay, so the trachea is in midline placement. This time I'm gonna check your thyroid, okay? But I'm gonna need you to have a sip of some water and then swallow. I'll give you instructions, okay? And this will check on cranial nerve number 10, which is the vagus nerve, okay? Hold on to it and then I'm gonna tell you when to swallow. Okay, go ahead. Take a sip. And then swallow. Okay, good. I'm gonna do it on the next one too. Okay. Take a sip and swallow. That's great. So lobes are small and smooth. The gland rises freely with swallowing. So the right lobe is a little 25% like larger than the left. The tissue is firm and pliable. I'll be checking on your neck right now. Okay, I'll be checking. Do some inspection on your neck. Check on any jugular vein distension. So there's no distension on your jugular vein. I'm gonna need you to perform some range of motion movement. I'm gonna need you to put your head down, up, on your left side, up, back, up, and your right. Oh, okay. I'm gonna just put some resistance in my hand. Okay, and your other side too. Okay, I'm gonna need you to shrug your shoulders. Put it down. Okay. So that checks also the cranial nerve number 9, which is the spinal accessory muscle. Okay. So the trapezius and sternocleidomastoid muscle is bilaterally symmetric. Then I'm gonna have to palpate with your carotid pulse. This one. So each pulse is strong and regular. Okay. I'm just gonna check on your tracheal position. Can you swallow? Okay, so the trachea is in midline placement. This time I'm gonna check your thyroid, okay? But I'm gonna need you to have a sip of some water and then swallow. I'll give you instructions, okay? And this will check on cranial nerve number 10, which is the vagus nerve, okay? Hold on to it and then I'm gonna tell you when to swallow. Okay, go ahead. Take a sip. And then swallow. Okay, good. I'm gonna do it on the next one too. Okay. Take a sip and swallow. That's great. So lobes are small and smooth. The gland rises freely with swallowing. So the right lobe is a little 25% like larger than the left. The tissue is firm and pliant. Your lymph nodes, Joshua, okay? So I'm gonna start with occipital, so not palpable, post-auricular, not palpable, preauricular, not palpable, tonsillar, not palpable, submandibular, not palpable, submental, not palpable, anterior cervical, not palpable, posterior cervical, not palpable, and lastly supraclavicular, not palpable. So I'm just gonna check your carotid arteries using my stethoscope. Strong and regular, no brewing. And strong and regular, no brewing. No vascular sounds that's heard. We're gonna do examination of your upper extremity, okay? I'm just gonna check on your arm, your skin, your shoulder, and your nails. So nails is pink. Gonna check for your pulses and your radial pulse. It's 2+, strong and regular. Brachial is 2+, strong and regular too. Your left radial is 2+, strong and regular. And it's 2+, strong and regular. I'm gonna check on your brachial radial reflex, Joshua, okay? Okay, good. So the brachial radial reflex is 2+, great. Pronation of your forearm and flexion of your elbow. Okay, with the other one. Same thing on your left. Brachial radial reflex is 2+, great. Pronation of your arm and flexion of your elbow. We'll do the muscle strength test. I'm gonna need you to flex your elbow. Okay, just go. Alrighty. So grade 5, full range of motions against gravity with full resistance. I'm gonna examine your back. I'm just gonna inspect your skin. So there's no skin lesions or any scar. Your back is symmetric. I'm gonna check your costovertebral angle. Any pain and palpation now? Okay, I'm gonna check for tenderness. Did it hurt? How about that? Did it hurt? So that's a negative costovertebral angle tenderness. Start your lung examination, Joshua, alright? So I'm just gonna put my hand in your back and I'm gonna need you to take a deep breath. Okay, blow it off. One more, take a deep breath. Blow it out. So there's a symmetric expansion of your lung. Okay, I'm gonna say word 99.
99.
Okay.
99. 99.
Okay.
99.
Okay.
99.
Okay. So there's equal vibration to all lung fill. I'm gonna start with the percussion. Okay. Okay, Joshua, so on your percussion resonance all over your lung field. Okay, Joshua, I'm gonna measure your diaphragmatic excursion. Okay. I'm gonna need you to take a deep breath and hold your breath. Hold your breath. Okay, relax. Okay, one more, take a deep breath and hold. Okay, breathe. Okay, okay, take a deep breath again. Okay, breathe. Okay. Take a deep breath again and hold. Take a deep breath. Okay. Okay, breathe. Your diaphragmatic excursion is measuring to 3 centimeters for both of each lung field. Alright, take a deep breath. Right off. Go ahead. Go it off. Okay, go ahead. Go it off. 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 Go ahead. Blow it off. Go ahead. Blow it off. So, vesicular breath sounds in all lung fields. Anterior chest skin is intact. No pulsations or heaving. Your ribs and clavicle are prominent, and there's an easy rise and fall of your chest during respiration. Just gonna palpate your chest, Joshua, okay? I didn't feel any precordium thrills, hips, or pulsations, okay? And there is your apical impulse. Go ahead and say 99.
99.
Okay.
99.
Okay.
99.
Okay.
99.
Okay.
99.
Okay.
99.
Okay.
99.
Okay. Equal vibrations on your anterior chest. So there's no change in tone before sternal borders. On left, loss of resonance, generally close to the point of maximum impulse at the fifth intercostal space. Okay, just gonna listen to your heart sound, Joshua. Okay, let me start with the aortic area. So heart rate and rhythm are regular. S1 was heard best at the apex and S2 heard best at the base. I didn't hear any S3 or S4, no murmurs or gallop, no rubs on auscultation. Okay, Josh, I'm gonna start examining your abdominal. Okay, Joshua, I'm gonna check your abdomen, okay? Your skin is intact, no lesions. You have a flat abdominal area. I'm gonna listen to your vowel sounds, okay? Very active vowel sounds. I'm gonna listen to your aorta, abdominal aorta. I'm gonna listen to the iliac arteries too. Check for your femoral artery. Okay. 2+ pulses on your femoral artery. 2+ pulses on your left femoral artery. I'm gonna start percussing your belly, okay? Just relax. So tympani. Okay. So that's the liver border right here where I start feeling the dullness. I'm gonna start palpating your belly, okay? Any pain? So no pain, no tenderness on the abdominal area. Let me just palpate your kidneys real quick. There you go. On this side right here. Okay. I'm gonna take a deep breath. I'm just gonna palpate your liver. Okay, so I didn't feel any swelling on your liver. Okay, this time I'm gonna check for your abdominal muscle. Okay, so I'm gonna need you to raise your leg and then I'm gonna press it down. Go ahead. Push, 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 push. Okay, good. Did you feel any pain on your right side?
No.
So that's a negative iliopsoas muscle test. Okay, I'm gonna check your obturator muscle test. I'm gonna move it on this side here. Any pain? Okay. How about on the other side? Any pain? Good. So that's a negative obturator muscle test on the right. Do on the left. Okay. Bend your knee. Okay. This on this side. Nope. That's good. So that's a negative obturator muscle test on the left leg. I'm gonna check your lower legs, Joshua, okay? So skin is intact, no scars or any bruising on both legs. Temperature is warm. I'm just gonna check your pulse. I'm gonna check your dorsalis pedis. So the grade of 2 in regular. And I'm gonna check your posterior tibial pulse. 2 and regular, 2. So on your right, so grade 2 and regular. And posterior tibial, 2 and regular. Okay, I'm just gonna check your knee reflex, okay? Just relax. Okay, so grade 2 on your reflex on your left knee. Okay, grade 2 on your right knee. Okay. Grade 2 on your left Achilles tendon reflex. Grade 2 on your right Achilles tendon reflex. Okay, so I'm gonna need you to raise your leg. Gonna push it down, then tell me, just go against it. Okay, so your muscle strength is 5+. I'm just gonna check the muscle strength on your cervical spine area, okay? Okay, go ahead, put your head down. Center, back, center, right, center, left, center, look on your right, center, then left, center. Okay, I'm gonna need you to stand up. I'm just gonna check your thoracic spine and your lumbar. Okay, go ahead and lean forward. Okay, spine is straight. Go ahead. And then lean backward. Good. So full of range of motion. Okay, I'm gonna need you to move your hips around as far as you can. That's good. So cervical and lumbar spine with full range of motion. Okay, Joshua, this is gonna be the last part of our examination. Okay, I'm gonna need you to close your eyes and open your hand. I'm gonna give you an object and tell me what it is.
House key.
Okay, how about on this one?
Coin.
Great. So that's the stereogenesis. You were able to identify the object that I gave you with your eyes closed. Okay, I'm gonna give some light strokes on your arm. So tell me where it is.
Left side.
Left what?
Arm.
Okay. How about this one?
Right leg.
Okay, good. Okay. The next one is going to be the superficial pain. Just tell me if it's sharp or dull, okay?
Sharp. Sharp. Dull. Dull.
Okay, that's good. You were able to distinguish between the sharp and the dull sensation. And that ends for our examination. Thank you very much.